Here at Sibley, the Division of Neurological Surgery treats all aspects of neurological diseases of the spine and the spinal cord with the most up-to-date techniques and technologies. And 2 doctors in the division learned about neurosurgical excellence in a very unique way. They are carrying on a family tradition in neurosurgery that spans 3 generations. I'd like you to meet Doctors Joshua and Matthew Ammerman.
Our grandfather, Harvey Ammerman, was one of the early pioneers of the neurosurgical program here at Sibley. And then he practiced with our father, Bruce Ammerman. And then I had the opportunity to join my dad for a short period of time, and then been working with Matthew since. Do you remember that fella that we did the 2-level spondylolisthesis repair on, who had the congenital spina bifida?
Yes, we looked at his films a couple days ago.
Yes.
The Ammermans specialize in neurosurgery at Sibley, and many of the procedures they do use minimally invasive techniques.
When you talk about minimally invasive spine, you mean doing less damage to the patient with our efforts to treat their underlying disease. It means making smaller holes, it means losing less blood, it means reducing the risk of infections, it means getting people back on their feet faster.
Well, Minneapolis was good, and then Philadelphia for to see your grandson. I love the challenge of seeing a patient, figuring out what their problem is, and offering them a practical solution. What happened?
Dr. Josh Ammerman performed minimally invasive back surgery on Leo Wollemborg recently at Sibley.
You're the other half. I'm the better looking one.
With Dr. Matthew Ammerman's assistance.
My whole experience at Sibley generally was excellent. 5 days in the hospital, relatively painless. Couldn't ask for more.
And both surgeons agree. It's a team effort that makes it all work efficiently for the benefit of the patients.
The radiologists work with the neurosurgeons, who work with the pain docs, who work with the physical therapists, that bring the whole package together.
Now I want to remind you, don't overdo it. I mean, we do get to change people's lives. We let them walk again, we let them work again.
And that, the brothers say, is what makes what they do so rewarding.
That thank you note, that thank you, that handshake, sometimes even that tear from the patient is why I do it.
Yep.
And there's nothing more rewarding than somebody saying thank you.
While technology has advanced a great deal since their father and grandfather practiced decades ago,
That's right.
these 2 neurosurgeons always remember things they learned from them that still apply today.
I remember the passion and the need to take care of people who cannot take care of themselves.
So Matthew and I go to the waiting room to pick up our patients, as opposed to having a nurse bring them to an exam room and us come to them. And I do that, Matthew does that, because he did that, because he felt, and I completely agree, it's a courtesy that you're extending to a patient, and you're making them feel that they're not on an assembly line. It's not a conveyor belt. They're a person, and you greet people at your door at your home. You don't just leave the door open and have them come to meet you at your table.